Good afternoon, everybody. My name is Breda O'Mara, and we're just going to wait for people to come online before we get started with the webinar today. So we just give people an opportunity to come online. You're all very welcome. I can see the numbers increasing very quickly here. So you're all very welcome to our Aware webinar today. I'm just going to give people an opportunity to arrive online before we get started. But just to say you're all very welcome. Again, to welcome you all as you're arriving. We've had a huge response to this webinar today, so it's wonderful to see so many people interested in understanding and managing their mental health during this very difficult time. Okay, so we're going to get started because it is after 12 and we have quite a number online already. So just to welcome you all, my name is Breda O'Mara and I'd like to welcome you today to Aware's very first webinar. We're delighted with the response. We've had a huge response and a huge number of people showing interest in the webinar today. So for those of you who don't know, Aware is a national mental health charity and we provide information, education and support to people around mental health, principally to the areas of depression, anxiety and bipolar disorder. So today, just to give you a very quick overview of what's going to happen, we're going to have 3 speakers. And then at the end, we're going to have a question and answer session. So if you bring your cursor to the bottom of your screen, there you'll see Q&A. So if you would like to ask a question at any stage during the talks today, please put your question in there and there will be, all those questions will be taken into consideration and we'll have a question and answer session towards the end of the hour. So the main reason we're doing the webinars this week is because Saturday, as you know, is World Mental Health Day. That's Saturday, the 10th of October. And our talks this week are very much about COVID-19 and the impact it's having on the mental health of the nation. And I suppose it's timely really that we're having the webinar today, considering the 48 hours that we've just been through and the increase in stress for people and the increase in anxiety that people have felt in the last 48 hours as we were wondering, are we going back into level 5 lockdown or are we staying in level 3 and all the different decisions that were being made. So it's very timely. So I'm delighted today to be introducing our 3 speakers. So our first speaker today is Dr. Keith Gaynor, and Keith is a senior clinical psychologist and assistant professor in clinical psychology at UCD. And he specializes in CBT, or cognitive behavioral therapy, for anxiety disorders and depression. He's also a published author. He's written Protecting Mental Health, and he's a regular contributor to media on a range of topics relating to mental health. Dr. Declan Lyons then is a consultant psychiatrist and he's a clinical associate professor at Trinity College in Dublin. And he specializes in mental health of older adults and he has a special interest in depression and its impact. He's also the director of the Evergreen program, which is a therapeutic group psychoeducational program for the rehabilitation of older adults with mental health difficulties at St. Patrick's Mental Health Services. And he coordinates a memory clinic there with an emphasis on early diagnosis of dementia and other memory disorders. He's also a published author and a regular media contributor. And then Dr. Claire Hayes is consultant clinical psychologist, and she's also clinical director here at Aware. And she runs a very successful consultancy practice, helping people of all ages to understand and manage a range of challenges, including anxiety, bullying, chronic illness, and depression. And she's a widely published author with a number of books published to her name, and she's a regular media contributor. So I'm now delighted to introduce our first speaker, Dr. Keith Gaynor. And Keith is going to talk about the impact of fear, self-isolation, and lack of social contact and the decimation of normal routine on our emotional well-being. Thank you, Keith.
Thanks, Breed. I thought I'd go for a really catchy title that would work very well with the media and that everyone would understand. And I suppose, but I think that this actually is a good description of how we've been over the last 6 months. These are the things that are impacting us and impacting everybody. And if we had any sort of vulnerability before this, these are the things that are acting on top of that vulnerability. So we're going to talk very briefly today about some of the things that are happening for us, and then very briefly about one or two of the things that we can do. So I think one of the things about understanding maybe the anxiety we're living through is that we should be feeling anxious. There's a pandemic on. There's a very serious virus out there that we don't have control over. And so feeling anxious is a very normal, natural human response to a difficult and dangerous situation. And our challenge then is to feel that anxiety and to manage it and to live a normal life and to do the things and have a quality of life that might keep us happy through this period. So next slide, please, there. And so one of the things is anxiety management courses normally teach us that we're too anxious and the risks that we face are small. And that in reality, the risks are the little lamb and they're not that dangerous. And if we thought more rationally or managed our mood a little better, then we shouldn't feel as anxious as we are. I think if you click again there, Jamie, actually, this is not the case for what we're facing. The risks we face are very real, and everyone in the country has been affected medically or socially or economically. And so we probably aren't too anxious. In fact, we are probably having an entirely natural human response in the face of a very real threat. And so if we're having increased heart rate, if we're having difficulty sleeping, if our mood is dipped because we're locked down at whatever level we're locked down on, then actually there's something very natural and human about that. I think there's something maybe about accepting our own response as an appropriate response to the dangers that we're facing. So when you think about how that might impact us, we can think about that in three ways. We can think about it biologically, psychologically, and socially. And so biologically, that might impact our sleep or our diet, our chance to exercise, or our chance to move throughout the day. Psychologically, it might impact how much worry we feel, maybe a sense of loss about things that we haven't had the opportunity to do, or a sense of loss from the people that we haven't had an opportunity to see. And it's very easy to fall into a state of catastrophic thinking. We see the worst possible outcome. And then for a lot of people, we have increased work stresses, either through a lack of work or through trying to work at home or work in very difficult circumstances. We have reduced social contact, which is intrinsically stressful for human beings. We are by nature a social animal, and we really struggle when we're isolated. And then there's enormous financial pressure on people. And as we know from 2008 and that recession, that financial pressure alone has a huge impact on people's well-being and mental health. I think one of the things that's been most challenging about the COVID-19 crisis is that it attacks our identity. And I think of the things that make up our identity, often it's our job, maybe our role within our family, how we are with our friends, how we are with our colleagues. And that if we're working, we might be working from the back bedroom, and our colleagues are distant people on Zoom that we meet in an organized meeting every now and again. And our sense of who we are and our identity is chipped away at because our role and our normal behaviors have been chipped away at. And our social supports have been taken away. Friends, colleagues, family, and they're all there, but they're at a distance and they're not in a way that's most human to us. And I think one of the things we've learned is that for all the technology we have, that Zoom is not the same as a hug, and that meeting people through the glass or through the window or at a distance is not the same as being personal and close with people. And that we as human beings, as a social animal, we need that. We find that calming. We find social connection calming, and we find social isolation deeply stressful. And we're living with this sense of unpredictability. We don't know what will come next. From a Sunday to a Monday, we don't know. So it's very hard to plan or to problem solve. So this is a kind of complicated diagram, but it's relatively straightforward because I think it's close to what people are experiencing. That there's four main threats that people are experiencing: the threat from isolation, the health threat, the threat to our identity, and the practical threat around finances and housing and childcare and so on. And that's leading to an ongoing sense of threat in our lives. And that leads to emotions of anxiety and sadness and loneliness, physical anxiety symptoms, poor sleep and difficulty reducing our level of kind of physical anxiety. We can have very strong beliefs about the threat, and a lot of those can be catastrophic. We can get caught in behaviors that kind of make us do too much. And so we get very focused on very small things. We can end up worrying a lot. And something that I think is very particular to COVID is that we can end up with a very high cognitive load. So we have to think and rethink and make decisions all the time. Is it okay to go to one person's house or not okay to go to another person's house? How close should I stand to that person? Should I do this thing this weekend or not do it next weekend? And we have to rethink, and that in itself is very stressful. And so I think a lot of what we have to do is very practically work through each of these steps. And so that's to reduce and notice, firstly, the emotions that we're feeling. Not try to deny them, not try to tell ourselves that everything is normal or everything is okay. Notice that maybe we are feeling sad or we are feeling lonely, that none of us would have chosen this, and that 6 months into it, actually that has stayed with us and it's not easy. Notice the physical anxiety symptoms. And the very best cure we have for this is exercise. But we also know that being in our houses and not being out in the world has reduced a lot of the exercise that we would have just as part of our normal life. I was talking to somebody yesterday and they were just talking about what their job would have been, which would have been to get on the bus, walk from the house to the bus, walk from the bus to where they work, and that they would have moved for 3 or 4 hours in work, just between different desks in different offices. That people often didn't struggle to get their 10,000 steps when they're working in an office building or, in a retail center. But we'll really struggle to get our 10,000 steps in our own house or our own apartment. And that actually there's a real need to focus on our physical movement and our physical exercise. Notice what beliefs we hold about the threat to ourselves and the threat to our loved ones. Now, it's not that those beliefs are untrue, but are they the whole picture? And so we know the risks we face, but also we know that this isn't an all-consuming disease, that we are able to navigate around it. Most people do well from it. Most people won't catch it. And that we are able to find a middle ground between being cavalier and being utterly terrified of it. Notice how much time we're spending worrying about COVID. I think one of the things here is the amount of input. Are we looking at the news 5 times a day? Are we listening to the radio 5, 6 times a day? And actually, it's not changing often enough for that. We don't need to think about it all the time. This doesn't need to be the only thing we talk about. We can talk about our lives and the things we want and the books we're reading and the movies we're watching. And the COVID can be part of that and part of what we talk about, but it doesn't have to be the only thing. And then notice the pressure that we put ourselves under to make decisions. And notice that we can't make a perfect decision. We can make an okay decision with the information that we have, and then we have to go with our best guess in any situation. And often our intuition will have told us that really early on. I'm happy to go to that place. I'm not happy to go to the other place. And actually we'll have known that without all the mental process that tires us out. So I think if we can take those sort of tips and sort of guide ourselves a little bit through it, that although there's a sense of threat out there, and that's going to continue, that doesn't have to be as overwhelming on us as it might be. I think that's it, Jamie. I don't know if there's another slide there. No, there we go. Thanks very much.
Thank you very much, Keith. That was a really wonderful explanation of what's happening for us all at this time, and you know, acknowledging that it is normal, and it's normal for us all to feel anxious at the moment, and that it is a normal reaction to feel anxiety when there is an external threat like the pandemic. So thank you so much. I just would like to welcome the other people that have come on. So some extra people came on, Keith, at the beginning of your talk there. So just like to welcome you to our Aware webinar today. And just to remind people that at the bottom of their screen, there is a Q&A button. If you want to ask a question of any of our panelists, we will have a question and answer session at the end. So you're very welcome to put your questions forward. So now I'd like to welcome Dr. Declan Lyons, who's our next speaker, and he's going to be talking about coping with a pre-existing mental condition during the pandemic. So thank you very much, Declan. Looking forward to hearing you speak. You just need to unmute yourself there, Declan, please.
I hope you can hear me okay, Breed.
Yes, can hear you perfectly now, thank you.
That's great. I'm always a bit nervous of this technology. I feel this is the new boss. You may think you work for an organization, but I think I work for Dell Computing at this stage. I'm looking at it so often. So in terms of what I'm going to cover, I'm going to cover the COVID context and our emotional response to that, touching a little bit on what Keith has talked about. I'll look a little bit about pandemic historical precedents. Have we been here before? I want to talk briefly about the links between depression and inflammation. What are the risks to our mental health? What about self-care strategies and our top priorities? And I think all of us who are working in clinical mental health are asked, you must be experiencing a big upsurge in business. And is that the case? I'll try and maybe answer that. And if so, what may prevent it or address it? So in terms of the current context, as you know, this is a terrible statistic, 1 million worldwide deaths at least, and rising since the first COVID-19 case in China in late 2019. Over 32 million infections globally, and the second wave is approaching earlier than predicted, before even the first wave is ending in some countries, such as America. 60 million may be pushed into extreme poverty, according to some statistics, and some people say it'll be 70 million, according to the World Bank. And we don't have a definitive answer as to how this will all end. And the pandemic emotions, I think it's no overstatement to say pandemics are heartbreaking biopsychosocial health crises. They cause massive, tragic physical, mental, emotional, and economic suffering. And really, they are a challenge to how we've assumed a kind of a global interlinkage of all the planet's citizens as to how we've lived our lives. This unseen microscopic virus has changed absolutely everything. We're scared of uncertainty. We may fear the infection itself and the health fallout, and be very frustrated then with the lockdown and restrictions. And if we go back to when, certainly in Ireland, the pandemic first started in March, I think we were in a state of panic when we were told to lock down and face the worst. And we were, you know, our anxiety levels collectively were very high. But then there was a gratitude perhaps that the worst didn't happen compared to other places. And we all like to compare ourselves with other countries and benchmark how we're doing. I think we took a pride in our frontline workers, and even the government got some positive comments for a change in terms of how they managed it. But now we're seeing frustration that the infection still persists, as do the countermeasures and restrictions, and there's a huge anxiety about the fallout, particularly economically. But we have been here before historically. The Spanish flu of 1918 to 1920 had 4 waves, as you're probably aware, and eventually, thankfully, it attenuated and petered out. But not too many people recall the 1957 and 1968 Asian and Hong Kong flus. And I ask all my older patients, do they remember those epidemics? Because they caused 2 million deaths between them, mostly outside of Europe and Asia. But we've seen other viral infections, HIV/AIDS, SARS in 2002, 2003, COVID-1, where there were 8,000 cases globally, but only 774 deaths, thankfully. However, again, we've seen swine flu epidemic of 2009, Ebola 2013, Zika, which threatened to upset the last Olympic Games, and it goes on. And we will see further viral pandemics, I'm sure. If we look at the Spanish flu, I mean, that was a massive historical event, which has kind of been forgotten about. We all know about World War I, and when people talk about 1918, they think, well, at least people stopped killing each other in Europe in World War I. But in fact, the Spanish flu was a great medical holocaust, the worst since the Black Death in the Middle Ages. 500 million infections, at least 50 million died in all countries across the world. And circumstances were very different then. There was a malnourished population, no antibiotics to treat secondary infection, and troop movements undoubtedly spread a second wave. Psychological effects associated with that pandemic were studied subsequently, and Mama London and colleagues looked at admissions to Norwegian asylums for 6 years afterwards and found a 7-fold increased admission, which tended to persist after the pandemic was over in terms of its physical manifestations and infection rates and so on. Interestingly, the mortality rate was greater in younger people as opposed to older, and there were theories about that in terms of older adults having immunity from the Russian flu of 1889 to 1890. But reports of psychiatric symptoms and neurological symptoms began to trickle through: depression, dizziness, fatigue, and links to encephalitis, and damage to cells in the brain producing dopamine, causing Parkinson's-like symptoms. Now, that association is somewhat controversial, but there were certainly plenty of observations about that. And the suicide death rate rose in parallel with the influenza death rate in America after 1918. And it's an open question as to what will be the direct COVID effects be on the brain. And I think we're only just getting to see that, and I think time will tell. We know about the damage to the lungs and the heart, and we know COVID can be a multi-organ disorder. There have been links between inflammation and depression, and these links have been speculated about for many years. And Ben Ross, hospitalization for infection increases the risk of subsequent mood disorder by up to 62%. And the symptoms may be quite atypical. They talk about a sickness behavior involving symptoms such as fatigue, joint pain, amotivation, poor concentration, and headache, as opposed to an emotional profile of symptoms. We know that in ME, or myalgic encephalomyelitis, or chronic fatigue syndrome, that has been postulated to have a viral underpinning, but the exact virus is unknown. When people looked up at the long-term follow-up of SARS and COVID-1 cases, from a psychological point of view, a large proportion of people were left with considerable psychological morbidity, and people were still, the majority, not back working after 2 years. Now, these were a hospital population, people treated in hospital, I should say. In terms of depression and infection, it does work both ways. People experiencing depression themselves are more likely to be positive for influenza A and B, and influenza B has been associated with increased risk of suicide. And also people experiencing depression are more likely to pick up the common cold through rhino or coronaviruses, 35% more likely in one German study, 2.5 times the risk in Korean study. And really, depression may affect the immune function via a number of ways, through smoking behaviors, alcohol use, sedentary lifestyle perhaps, or even a simple nighttime cough affecting your sleep, which can always disrupt mood. Intranasal steroids can affect mood also, and sometimes vomiting reduces antidepressant absorption, for example. I suppose in terms of the stress responses, what Keith has outlined earlier, and these stress responses are very understandable, and thankfully they are not diagnostic of a long-term enduring mental illness. We can identify with insomnia, sleep disturbance, a sense of anxiety, terror, fear, trauma, fear of infection, financial damage, separation from loved ones, alcohol misuse. When alcohol goes from the social space into the domestic space, certainly a lot of damage, trauma, domestic abuse, violence can happen, and so on. We can see regressive behavior in adolescence. We have a sense of grief and loss for our past routine, the loss of our distractions, an irritability, a boredom, and frustration with lockdown. So understandable emotional responses. But what about the risks to our mental health? Certainly, we are seeing an adjustment disorder, a longer-term stress reaction, possibly worsening OCD, possibly new cases of depression and relapses of depression, worsening anxiety, psychosis possibly, and increased suicide due to anticipated and actual human and financial loss. Certainly, accessing supports for people who have a pre-existing mental health condition can be difficult, and services have become harder to access. For people who are staying at home and socially distancing, that can become a social avoidance and a long-term social isolation, which may need a clinical intervention later on. And we have not to forget, I should say, that when we see any crisis that worsens inequality and social advantage, I think we're going to see mental health fallout from that. In terms of the effects of quarantine then, I think this is an equal opportunity offender. It affects everyone, those with the pre-existing mental health illness and none, and healthcare workers themselves. And acute stress disorder and PTSD is particularly common, by the way, in healthcare workers and frontline workers, and maybe quite high in children as well. And if we're in a strict lockdown, and thankfully in Ireland we've avoided that, I suppose, for a while at least, those lockdown effects can be worse if the lockdown is very severe, if it goes on for more than 10 days. If there are real fears of infection, this is different from a type of quarantine that you have to experience, for example, going to Australia or New Zealand, where it's part of your entry into the country now, where there's intense frustration or boredom, or obviously worries about food supplies and medicines and lack of information. And obviously the outcome is worse if there are later financial fears, or if someone has picked up the infection and they're stigmatized by their peers for that. That can predict a worse quarantine effect. So how do we look after ourselves? I suppose it's important to recognize what is typical and what isn't. And what I've talked about before might be very typical and understandable, but there may be signature relapses associated with a pre-existing mental health condition that can be very typical in terms of previous symptoms. So recognizing that, I think, is important. Getting help when it's needed. Asking for help is an act of bravery. Taking care of body, mind, and connection with others. That's the fundamental thing, I suppose. They're the principles we have to remember. And practically speaking, we need a lockdown plan, perhaps, from access to medication and shopping, to crisis contacts, to budgeting. And we can talk a lot about and bemoan what we can't do and what we're missing out on, but what are the permissible actions? What can we do? You know, even if we approached level 5 lockdown in Ireland, we still have 5 kilometres, I suppose, radius from our homes in which to take exercise and fresh air. I think it's important for those of us are out there that do have a mental health problem pre-diagnosed to review our crisis plan and add to it. Call the mental health team that you're engaged in for tips. Note your specific questions and items you need to discuss. Really think about who you'd call at 2 a.m. for support and important phone numbers. Whose numbers do you really need to have on hand? Maybe it's your GP, maybe it's the Aware helpline, maybe it's significant others. And identify new supports for standby. Embrace all the tools. So it may be that maybe medication may be tried or recommended for you, or maybe medication dose adjustments may be tried. So go with those without maybe judging yourself or seeing it as stigmatizing. And we can focus a lot on what we can't control, how the virus will pan out, what other people are doing, what Donald Trump is saying. But we can focus a lot on really on what we can control, what we watch, what we read. Do we disconnect from the media, from all this data for our own health? What about our new routines? What about our diet? And what about staying communicating and connected with other people? These are really useful strategies. Experts talk, and I don't want to sound like a bad self-help tape, but 5+1 ways to well-being, learning and developing new skills. Now, we don't have to write a novel or learn the ukulele, but there may be new things that we could try out that we've been meaning to do for some time. What about connecting by embracing new technologies? Many older patients of mine have done that. Mindfulness skills and implementing those. Giving and the camaraderie of volunteering is profoundly good for meaning. And being active, taking physical exercise. This is the miracle cure for everything, physical and psychological. It's safe for virtually all and dangerous to abstain from, as you know, and building a routine for ourselves. Physical health promotion. Now is the time to really look at it. Looking at our habits, looking at smoking, obesity, vascular risk factors, alcohol, and other lifestyle issues? What about home exercise? If we are locked in and we really have to stay indoors, can we even reduce the amount of time we spend sitting in one position, even if it's standing up at the ad breaks or walking around our desk or our computer screen every 10 minutes? Maybe we need to get used to the idea of having a vaccine, because hopefully there will be a vaccine, and I'd be optimistic there will be, by having the flu jab this year. What about vitamin D deficiency? We won't do ourselves really any harm by looking at that. And as you know, the levels of vitamin D, and if you are deficient, that can predict a severe COVID illness and associated mortality in a number of studies increasingly. And I think in terms of physical health promotion, we need to revisit our own personal mitigation measures. Are we good at implementing them? What's the COVID drill that we're doing in terms of distancing, mask wearing, hand hygiene, respiratory and cough etiquette? Are we lax in any of those? Being honest with ourselves, and can we double down on those efforts? And I think if we're going to avoid further restrictions, we really have to do that. In terms of managing our health, now is the time to resume appointments. If there's blood levels to be taken of medications, for example, of lithium, we need to get those done. We can't keep putting them off. Obviously, accessing medical care was very challenging in the early stages. Our blood pressure monitoring, our blood test monitoring of glucose, cholesterol, and so on. Is now the time, really the best time, to come off medication, whereas it may be more appropriate to batten down the hatches if something is working, to maybe stick with it until there's less maybe uncertainty in the bigger environment. Knowing our numbers, our cholesterol, glucose, blood pressure, and other essential parameters. One of the biggest fears I think a lot of people will have is actually getting sick from non-COVID related medical issues and accessing appropriate care. So what are the key symptoms that we need to remind ourselves do need immediate attention from our primary care physician, our GP? I would say maybe bleeding from anywhere, rapid weight loss, persistent hoarseness or cough, swellings, abdominal pain, pain that seems very different or new. Often a rule of thumb is if something persists for 2 weeks or longer, get it checked out. Improving services. People who have a pre-existing mental health condition, if they can come out of it at the other end with better, more responsive services, that would be a real COVID bonus. So maybe you'll have suggestions, and maybe now is the time to be vocal about putting out calls for change, asking for online mental health resources, even IT lessons. We have had to do that in St. Patrick's Hospital here. We have had, our IT department has reconfigured to provide people with tablets and pad devices to allow people access mental health information. So suggesting ways services can be reconfigured. We all know people with mental health crises really shouldn't be going to A&E. So what is the alternative? Can we have a debate about that? How can services be combined across hospitals to do more, better and safer? And find out from your healthcare team what's the best way to access urgent help and to communicate with the team. I suppose we're having to deal with a lot of uncertainty, a lot of unknowns. There's a lot we can't control. How long this will last, what others do. Uncertainty is about multiple potential, unpredictable and uncontrollable outcomes. But uncertainty can be a bit of a mental stimulant. It doesn't have to be all burdensome. It can be motivating, it can improve our decisions, it can boost creativity and empathy. And we can keep boredom at bay in micro ways by boosting this uncertainty tolerance, by trying new things, reading fiction, doing things that we're postponing, having the deeper conversations with people, not just the superficial, but maybe sharing our deepest fears, leading as well as following. Humanity in lockdown. What I mean by that is, look, and I shouldn't confess this, older patients have asked me, look, this lockdown is wrecking my head. What do I do? I confess, said to people, look, if you're going to take a walk, do it in the very early morning when you won't bump into anyone. And I know it's not what we're supposed to say. We're supposed to say stay indoors. But I asked a man who told me that he walked around the grounds of Dublin City University every day during lockdown. And I said to him, what do you do if you come across people and you can't keep your distance? And he said, well, it's like this. I just move onto the grass verge. And sometimes I've stayed walking on the grass verge. It's softer after all. So how do we find our own grass verge in terms of the restrictions? Maybe we can soften them a little bit. We need to admit our vulnerability, acknowledge concerns and fears, discussing our needs and other people's needs. We've seen great community mobilization, and in Ireland we have the Gaelic Athletic Sporting association that has really stepped in and helped a lot of older people out with their shopping and attending to essentials. I think looking after people who are older and who are medically compromised has been a great gesture of intergenerational solidarity. It really has been, and hopefully we can sustain it. And also younger people have shown the older generation that computers are not improvised explosive devices and that they can be used very usefully. Interestingly, I've seen some people who say that they've improved during lockdown, and some people with a pre-existing illness feel that the pressure is off. This constant sense of having to compare themselves with others, because some people didn't seek those kind of novelty and distractions. And in a way, symptoms of depression during a pandemic may be a bit functional in that they call on us to isolate ourselves to stay safe. So there can be a safeguarding, an introversion that is a little bit safeguarding, but obviously we don't want to become isolated. And in any crisis, when there's a solidarity and a banding together to deal with it, we can see a fall off in distress levels in the early stages of the crisis, because the worst may have happened. You're not anticipating it anymore, and it gives perspective about our own personal challenges and problems. People have talked about a great relief in not having to go into work, to have to perform and behave and look in a certain way. And some people have relished home working, for example. Will there be a tsunami of mental health problems? Certainly we have seen a surge in anxiety among the young especially, I think. But that may not predict long-term mental health difficulties, although we are still discovering the long COVID syndrome and the neurological effects, as we've said, of severe illness. In one interesting survey in the US, in New York, they looked at medication usage in March as opposed to February of this year. And in terms of the prescribing rates of hypnotics, antidepressants, and anxiolytics, the rates rose in March as opposed to February by 5 to 15%. But interestingly, the rates fell back again in April. So suggesting that people are maybe adaptable, inventive, and resilient. Leaders, what can our politicians do? We need clear policies applied dynamically and consistently with clear communication. And the leaders have to translate and apply scientific information, as we saw in Ireland in the last 48 hours, displaying empathy and focusing on the broader community well-being. We need to focus on economic relief, certainly, and we will need to continue to do that for a long time afterwards to prevent turning distress into disorder. And it's okay to be honest with people, but not to give a deluge of information always. So what are the COVID opportunities as I come to the end of this segment? Well, what systemic failings need correction in our health services, in our society? What personal behaviours need modification? It really is a call to all of us to look at our health, our lifestyle, our obesity levels, our consumption, our selfishness, our damaging the environment. Can we delay our gratification a bit more and get our needs met more sustainably by simplifying our lifestyle? Can we gain perspective? We used to delude ourselves that progress was inevitable, but human advancement is not always linear. It does go backwards sometimes for a while. But can we above all aim for post-traumatic growth? We are, after all, making history in these very interesting times. The stance of mutual support and solidarity is just beginning. We are going to have to support ourselves for a long time yet, sharing the health and wealth risks evenly across the generation. If older people are having health risks and younger wealth, can we redistribute that to some extent? And a post-COVID recovery maybe could neatly hitch a ride onto the environmental protection and renewal of the environment. As Nelson Mandela says, that whatever choices we make, may your choices reflect your hopes and not your fears. Thanks for your attention.
Thank you very much, Declan. Again, fascinating. I love that quote at the end from Nelson Mandela. I think it ties in very well with what Keith was saying as well about, you know, the choices we make and what we're choosing to do at this time during COVID. Just to say, a number of people have been asking questions, and we're going to have a question and answer session at the end, but just I'm going to answer a number of people now, if that's okay. We will be sending the link to this webinar to everybody who has registered. We will be sending it to you to your email tomorrow, and it will also be on our Aware website. So just to answer that question. Anybody else who'd like to ask a question, if you go to the bottom of the screen, there's a Q&A button, and you can put your question in there, and we'll have a question and answer session after the next section, which will be led now by Dr. Claire Hayes. Claire, you're very welcome.
Thank you, Bree.
Claire is going to lead an in conversation piece, and she's going to discuss with Declan and Keith the impact that Aware has noticed as a result of the pandemic. Thank you, Claire. I'll hand over to you now.
Thank you very much, Reid. And thank you, Keith and Declan, for a really excellent presentation, each of you. And I could feel my own anxiety levels going up as you were speaking. And then as you were coming towards the end with practical solutions, I could feel myself becoming a little bit more relaxed. And what we have noticed is, it's maybe a little bit of a paradox, but people who have experienced anxiety and have got support for it over the years, some of those people are in a better position because they have tools, they have a sense of that they know what to do and they can get through it. But a lot of the people who are contacting Aware for support are people who are frightened and shocked by experiencing anxiety and depression for maybe the first time in their lives. There might be people who have been incredibly resilient, people who everyone else has looked to for support. And my sense is some of those people are being really hard on themselves right now. So maybe if I could ask you first, Keith, what advice, what suggestions would you have for people like that?
Well, I just echo that observation that actually quite a few people I've met who've had long-term depression and anxiety have kind of commented to me, now everyone in the country knows how I feel. Or people who've struggled to go outside, or people who've had extraordinary fear in their lives. So actually everyone now is in the same boat that I've been with for years. So just to echo that. In terms of, I think one of the real difficulties about what we've gone through is that a lot of our normal supports have been taken away. And so typically you'd advise people to meet friends, go out, play sport, go out, do something pleasurable, go and enjoy ourselves. And of course, those things are much more limited for us. And so the gap then has to be creativity. What we have to do is what we would have liked to have done in 2019, and maybe are slightly hindered doing now, but getting the same outcome in slightly different ways. And I have no perfect answer for that, but I do know what I'm doing in my own life. So I'm not going out to dinner particularly often, but every Friday night we're having a Zoom takeaway with friends of ours, different friends. And so we're both getting Indian takeaways into the house, setting up Zoom. We're on one couch and we're Zooming, friends of ours on another couch. And so we're trying to keep that social contact, but in the ways that are possible for us. And I think it's still thinking through, what do I need? What difficulties am I having? And then how can I go and get them in new ways? And not being hampered that I can't do it because the old ways are blocked to me.
That's really helpful, Keith. Thank you. And I'm just struck by, as you're speaking, that none of us, even if we might feel isolated, people are living on their own these days. Some people, we're still part of families. And we know that when people are experiencing mental health difficulties, it impacts not just on themselves, but also on their families. So Declan, if I could ask you, please, when you're talking about people who are experiencing an increase in mental health difficulties, what advice would you give to their families, their friends who are supporting them, who also might be experiencing such difficulties for the first time? And maybe the roles they had before in supporting their loved ones, it might be just a little bit more difficult for them to carry out those roles.
It's very challenging, but I think people are responding still and keeping up their support with modified behaviours. It's the visit through the window of the nursing home. It's better than nothing. It's making the effort to show up and show that someone is still in their thoughts. It may be that, as we were saying, we like the hugs, we like the greetings, we like the physical contact. The proximity is very, very powerful in terms of that attention exchange, which we can't quite do in the same way, but it's modification. It's showing that, the support network is still out there. It can still deliver. It can deliver that concern and care. There can be practicalities that need to be done. And sometimes the practical gestures, that going out to the supermarket, getting the shopping, keeping your loved ones safe, is a supreme act of care and consideration. So it can be very much down to people's basic fundamental needs to survive and get through this and keep their loved ones, particularly older people, you know, my patients, away from danger.
And that's really important and helpful, but that's again the focus on supporting people who are experiencing difficulties. But what advice would you give as well to the people who are in the caring role about minding themselves? Because it can be a lot of pressure, you know, to visit the nursing home window every day, you know, and that people can be putting themselves under increased pressure.
Well, that's very true. And you know, I should say that in fact, most carers are themselves older, in my experience, but you're right. And people do a lot of juggling and multiple role balancing. And I think the Caring Act needs to be done in simple, consistent, sustainable ways. You know, phone calls, it can be spread across the board. Very often the primary caregiver in a family is one person, very often a daughter. So what can other family members do in terms of stepping up to the plate and using this COVID as a kind of a wake-up opportunity? But of course, carers need to think of their own needs and to take breaks, to make the caregiving gestures very sustainable in the long run for them and their lifestyle and the multiple competing roles, particularly that middle-aged people have. Middle-aged people are called the sandwich generation. They're the meat in the sandwich. They may have young kids at one end of the age spectrum and aging parents in the other end. So it's about looking to their own needs and giving themselves permission to take time off and not characterize their older relatives as perpetually vulnerable. Some older people that I look after would be very insulted by being regarded as always vulnerable or frail. They're actually healthy, vigorous, and active. A lot of them, but they're lumped into this over 70s age group and have to cocoon, which for some of them can be very frustrating.
Thank you. I'm conscious that lots of people have questions, so I just have one final question for you, Keith. When we're changing behavior, and I think a lot of the caretaking, the caregiving behavior is if we stop it, we can feel guilty. So people can want to do more and more and more because if they don't, they'll feel guilty. So if people are looking after themselves as a priority in a way that they didn't before, my sense is, and certainly from the people I've worked with, that they can feel more guilt. What advice would you give to them, please?
So I think there's something really important as a theme running through all of this is we have to remind ourselves too that we are also experiencing this. And we may never have experienced something like this before, emotionally or in our lives. And actually, this is going to be a huge challenge for us. And so there's a question I think we have to start with before what do I have to do is what do I need? And that's a simple question, but it doesn't necessarily have a simple answer. And that actually people have to spend a little bit of time working out, well, what do I need? And in any given week, how do I get that? And where do I find that? And where do I find that now? And if we start with what we need, which maybe to an Irish audience seems kind of selfish or wrong, or how could I possibly look after, myself first? But actually that nothing else works. If we're not well, the whole system breaks down. And so if we start with what I need, and it's often very simple things, then we're able to go and do all the things that other people need.
Okay. Thank you, Keith. So back to you, Dave.
Thank you, Claire. Yeah, it's been really interesting to listen to the conversation. There's quite a lot of questions have come in, and I know because it's 10 to 1 that we're not going to be able to get to them all, but I'd really like to put some of them to you. There's a lovely question here. How do we deal with touch deprivation? Keith, I might hand that one to you.
I think it's the hardest thing. I think it's absolutely the hardest. I think it's the thing we've been most robbed of. And I don't know if we knew how important it was before we lost it. And of course we knew, but did we really know? And that's for our colleagues and friends and people that you might have just put a hand on their shoulder, right up to the people who are closest to us. And what a hug communicates to the people who we're closest to. And there is no simple answer, other than trying to find it where we can find it. I think recognizing that there is a touch deprivation is the start. I have a kind of question to go out to people, which is how many people have bought pets in the last 6 months? How many people have brought, little loving things into their homes and into their families that they mightn't have otherwise done? And that we've often developed huge, powerful relationships with pets at times when we don't have access to people. And I'd wonder if that's a solution that lots of people have come to.
Yes, I think it is actually. I think a lot of people have done that. Claire or Declan, would you like to add anything to that?
I would. I'm doing an online course. I'm finding it really, really interesting, and it's with yoga and mindful movement. And there are two exercises that I find I've just loved. One is just giving ourselves a hug this way, and just very gently, and another is lying on our backs and lifting our knees up and putting our arms around our knees, and again giving ourselves a gentle hug. It doesn't replace anybody else's touch, but it's nice. It's a lovely exercise.
Okay,
I would just say elbows were meant to be touched as well. But look, you know, hand touching is difficult and handshaking. And when will we get back to that greeting? It's so difficult.
Yeah.
But there are ways around it. A lot of nursing care, I notice, in our ward is delivered in the very, very same way. But people are very conscious of the mitigation and the regular hand hygiene. But thankfully that is continuing.
Yeah. I think it's such a natural thing for us, isn't it, to reach out to touch somebody when we meet them, and it's almost alien to us to have to hold back, or like you say, touch with elbows. It's a real alien feature to us. Just to move on to another question, many people, I know we've dealt with this in a way already, but many people experience isolation and loneliness in the best of times, but restrictions have made this even worse. How do you support somebody who's feeling helpless and alone? Maybe Declan, could I give you that?
I think it's again starting with the recognition, and I think if someone is identifying it as a need, it is a need that, you know, has to be acknowledged, has to be reflected on, and has to be strategized. There needs to be a strategy to get one's needs for attention met, and people now, I suppose, will have a range of ways to do this in future. We know that technology can be a limited intermediary, but it's there now. And I think people will have experience of online communities that maybe we wouldn't have had as quickly, I think, and in such an accelerated way had COVID not happened.
Mm-hmm. Okay. And I know we're even finding and aware that, you know, people who were never able to access our peer-to-peer support groups previously are able to connect in with our online or our telephone groups now, where they wouldn't have had a group on their doorstep previously. So there are ways to connect. I'm going to put two questions together, if I could, here, because I think there's a connection between them. So one of them says, I try my best to exercise, eat well, practice gratitude and yoga, etc., but I'm finding it hard to lift this down feeling. Any advice? And there's another question then that says, how do you know if what you're experiencing is normal? And how do you know if you need help? Who'd like to take that?
I think to answer the second question first, it can be both.
Yeah.
It can be normal to feel down and struggling, and we might need help with it. And it's quite normal to need help at some times in our lives. Yeah. And so if you feel that actually you might benefit from help, then you need it. And then the decision is, well, at what level do I need help? Often a conversation with good friends and family are a good guide to this and opening up that topic. And then conversations with the GP. And actually GPs are really, really knowledgeable in this area and can guide us to actually where we are with something. And going to the first question is, we can try really hard and feel sad. And it seems like that person is putting in an enormous effort. And there might be something about acknowledging the sadness. I feel really sad and I'm working really hard on it, but I feel really sad for these reasons. And acknowledging some of the reasons why they might have sadness in their lives at the moment and being sad with that.
Keith has just frozen there momentarily. So Declan, I might move to you, and Claire, would either of you like to answer that?
I think going to look for help is an act of strength, an act of courage. It is not a sign of weakness. You're respecting someone's skill set and ability. You're borrowing their brain and their outside perspective and sharing your story, and having that objective, I suppose, listening to of your story can be very helpful. It can unlock many, many therapeutic avenues and suggestions. So I would just say, go and look for that help. from someone you trust, a trusted professional.
Okay. Claire, have you anything you'd like to add to that?
I just reiterate what Keith and Declan have said. I would think acknowledge the feelings. This is not a time for us to be feeling wonderful and excited. And, you know, there is a time, as we know, for all kinds of everything. So if we were, well, if I was feeling wonderful and delighted and excited and full of the joys of spring all the time at the moment, I'd be seriously worried about me. You know, I think it is normal for all of us to be feeling frightened, under pressure, upset. And all of the activities we do to make ourselves feel different, some of them work, some of them don't, because it's, in my view, it's not about feeling anything. It's about acknowledging our feeling, and it's linking that to whatever's causing us problems. So I feel upset because I think this is so scary. But, and then really the third part is this is what are we going to choose to do? So if we use A, B, C, so A is acknowledge, B because, and then C, what we choose to do. So I feel overwhelmed because everything that's happening, but I choose to take care of myself, but I choose to keep going, but I choose to remember I'm resilient, but I choose to act in a helpful way. So I think we need to get the balance between those three dimensions, acknowledging how we're feeling, and recognizing there's a reason for that. It's not because we're not doing our activities enough. It's not that going for 20 walks a day instead of 10 are going to make us feel better, and then focus on what we can do.
Okay. And I think that probably answers the next question as well, as how do we manage all the uncertainty? So it sounds like your ABC would also help that, Claire. Would you like to just maybe speak briefly to that, to uncertainty?
Thanks, Breed. Again, I feel uncertain. I feel scared because I think it is so uncertain. And I would put I think there in brackets, because sometimes, a lot of times our feelings are dependent on what we think as well as what happens. So even though it is an uncertain time, it's us thinking it can make it feel worse. So I feel scared because I think it's an uncertain time, but that's okay. It's okay to feel scared. There's nothing wrong with feeling scared. But I choose to mind myself. I choose to get and take support. It's easy to ask for support. It's easy. Well, it's not easy to ask for support. It's easy to get support, but taking it can be hard. And sometimes it's very difficult to ask for support. But I choose to learn from this is another one. I choose to manage my feelings of anxiety. I choose to remember that I've been through difficult times before. I choose to celebrate how well I did in the past. So there's lots of different things we can put with the but. So the A, acknowledge, the B, because, and the C, what are we going to choose to do?
Okay, thanks very much, Claire. And I'm just watching time now, so maybe just I might ask this question finally, and there's a couple of questions in this, relating to this. Are there techniques that can be used to separate the stresses of personal life from the working environment? And there's also some questions coming in around working from home, so the challenges of working from home. So would anybody like to take that? Keith, would you like to take that one?
Yeah, certainly. I was talking to a colleague of mine, and we were having kind of serious conversation over Zoom. And I heard this knocking on the door. Please, mommy, don't lock the door. And it's obviously a little person who's desperate to get in and join the Zoom conversation. And I think this is something that's been happening for lots of people, that we can't, we are no longer able to walk out the door and say work is in one place and home is in another, either geographically or psychologically. And that's really hard. Yeah. And so there's no straightforward answer to it, and I haven't seen anyone come up with a perfect answer for it. But I think there is sitting down and working out what our boundaries are as best we can. When am I on? When am I working? And when am I not? And when is a case of just getting through, just muddling through, not doing a perfect job at either parenting or working, but there might be a couple of hours where we're trying to do both. And it's okay to muddle through that.
Okay.
I just wonder about seeing the kind of, will we look in 20 years' time and say, my God, all that commuting was so futile, it was damaging the environment. We are at the forefront of change in the working life now, and the working routine, and that we're going to have this mix that we will ultimately blend to our own needs in terms of our routine, and that separation and creating those necessary boundaries. But it's early days yet. It's early days in this whole experiment, a massive social experiment.
Yeah. I think that's a very good point, that it is such early days and people are only beginning to find these new routines, you know. So while people talk about, well, I hated the commute, it actually was an opportunity to switch off and to switch on. You know, so forming new routines around that seems to be challenging for some people, but like you say, it's early days. So just trying to establish those routines. Claire, is there anything you'd like to add to that?
No, yes, there's one last thing, that there's an opportunity in the approach, you know, just building on from what Declan was saying. And I'm discovering that parents are learning to respond to their children differently. So maybe there might have been parents who every time the child was looking for attention, they got it. And now children and teenagers and us all, we're being forced, whether we like it or not, to develop our resilience, to learn to look after ourselves. And I think there's a wonderful opportunity in this. So while it's important to acknowledge that, you know, all the fear around, also it's important to look at that maybe, and let's put maybe in because we don't know, but maybe can be very powerful. Maybe there are really good things that are coming from this right now. And personally, I think there are.
Okay. So I'm conscious of time, so I think it's probably time to wrap up. And I think that's a very positive note to end on, Claire. I just want to apologize to anybody whose questions we didn't get to, because a lot of questions came in and we were trying to pick questions that were repeating so that we were answering most people. I just want to say a huge thank you to Keith and to Declan and to Claire for your wonderful talks today, and for your wisdom, and for your answering questions, and for your helping people at this time. This is, you know, a very unusual time. As you say, Declan, you know, we're forming new routines. It's almost like a social experiment. So we're feeling our way through the pandemic. So thank you all very much. I'd like to thank all the attendees who logged in today to hear the webinar live. It's been fantastic having so many people present. Thank you for your participation. I even noticed in the chat there, one person said hello from Kuwait. So I have to acknowledge that. And thank you very much for your time. You will receive the webinar in an email tomorrow, and the webinar will also go up on our website. Just also to highlight to you that we have another webinar on Thursday. That's Thursday, the 8th of October at 12 midday. And the title of it is The Wellness Session, Living Well for Body and Mind. And we'll be looking at how to navigate the new working world, how to build resilience, and some tips on how to proactively look after your mental health. If you'd like to register for that, again, go to aware.ie. And we're planning to start regular webinars from January. So keep an eye on our website. And if you'd like to subscribe to our newsletter, you'll be kept up to date with everything that's going on. If you'd like any further resources, please visit aware.ie to find multiple resources in relation to depression, anxiety, and bipolar disorder. And I'd like to thank you once again for being here, and thank our panel for their great presentations to us today. So thank you, and enjoy the rest of your day.
Thank you.